Hey guys, this is another episode of my TENS series, therapy, exercise, nutrition, and supplements. Today I want to talk to you about a very important supplement. Actually, one of the most important supplements, vitamin D. Vitamin D is often referred to as the sunshine vitamin. There are many physical and mental health benefits from using vitamin D. Let's talk about mental health first and how vitamin D impacts mental health. Research has shown that individuals with vitamin D deficiencies tend to be more prone to depression and anxiety. And of course, that means individuals who take vitamin D tend to have fewer symptoms or reduced symptoms, or may prevent a low mood or anxiety altogether. Vitamin D is critical for healthy bones and healthy teeth, mainly because vitamin D helps the body to absorb very important vitamins such as calcium and magnesium. Vitamin D is also a great vitamin for helping to build muscle. Vitamin D also lowers the risk of heart disease and diseases such as osteoporosis. Once again, of course, because vitamin D helps the body to absorb very important micronutrients such as calcium and magnesium. Vitamin D is also good for weight management, mainly because vitamin D and calcium together tends to help manage that appetite. Some of the symptoms of vitamin D deficiency are fatigue, body aches, low mood, and stress fractures. And of course, those stress fractures would be because the bones are weakened. Some of the most commonly used sources of vitamin D are fish, healthy fatty fish such as mackerel, salmon, and sardines. Milk is also a good source of vitamin D, fortified milk, of course. There's also fortified cereals, fortified yogurt, and egg yolks. If you have a plant-based diet, mushrooms are the best plant-based source of vitamin D. The best source of vitamin D is the sun. The body actually creates vitamin D when direct sun converts a chemical in the skin to vitamin D. So get outside, get active. Vitamin D paired with a healthy lifestyle promotes a healthy body and a healthy mind. Your primary care physician can send you to the lab and have blood work drawn and determine if you have sufficient levels of vitamin D in your bloodstream. If you do not, they may recommend an over-the-counter form of the vitamin and encourage some of the foods that I just mentioned. And some of us are typically on vitamin D supplements that are prescribed. I personally am on a vitamin D supplement prescribed by my doctor. During the winter months when people aren't outside getting as much sunshine, their vitamin D levels tend to be lower. And African Americans tend to be more prone to vitamin D deficiency. Everyone needs a healthy level of vitamin D in their bodies. And if you experience any of the symptoms that I mentioned, you might want to talk to your doctor about having your blood work drawn. You don't want to overdo it with the vitamin D. In any vitamin, excess is not necessary. So always talk to your physician about what is the best vitamin D supplement and regimen for you. Thanks for tuning in to TENS today. I'll see you soon.